I know right now there's so much stress and anxiety when it comes to pregnancy and newborns and breastfeeding in and of itself, but then add in this COVID pandemic and it's tough. There's a lot of things we don't know. There's a lot of questions. There's a lot of concerns. So I'm just here today to talk to you guys about that, try to answer some of the most commonly asked questions. If you have questions while you're joining us live, let me know. We also had some previously asked questions, and I'm happy to answer those as well. My name is Lyndsey. I am a registered nurse. I have been a registered nurse for 8 years now. I am also a mama coach, so I do prenatal educating, lactation support, newborn support. I do sleep coaching, CPR and choking workshops, all kinds of things related to moms and babies. I do also want to start by saying, I am a registered nurse, I'm a healthcare provider, but I don't want you to take any of this as medical advice. You should always consult with your healthcare provider. That's who you should always be working closely with. And I'm here to educate you, support you, give you some of the most up-to-date information, but always be working closely with your healthcare providers, okay? So when it comes to pregnancy, a lot of mamas are concerned about whether or not their baby could get COVID during pregnancy if mama gets COVID. Okay. So based on the data we have now, and you're going to hear me say this a lot. Okay. Just a little disclaimer. We have data, we have information, but we don't have a lot of it. This virus is new. It's a fluid situation. Things are changing a lot. We don't have an extensive amount of research on COVID in relation to pregnancy. But based on current data, we do not believe that COVID-19 is passed from mom to baby while in utero, okay? They've done testing of amniotic fluid, placenta, baby cord blood right at birth. And so far, they haven't shown that correlation of a pregnant mom giving birth to a pregnant baby. That being said, it can be spread once baby is born and has close contact with mom. So we'll get into some of that. The biggest way that this COVID virus is spread is through the respiratory droplets. And that's where you have to be really careful. So once baby's born, the question is, okay, do I get to stay with my baby? Do I have to be separated from my baby if I'm positive and if I have symptoms? The World Health Organization is recommending that moms and babies stay together. But the CDC and the ACOG, the American Academy of Obstetricians, they are cautiously recommending that mothers and babies be separated if mom is sick or symptomatic. Now, this isn't like an all or nothing. If you're sick and you're symptomatic, or you're positive and you're symptomatic, you're going to be separated from your baby. You have no choice. It's probably going to come on a case-by-case situation. So I would start having that conversation with your provider now. Like, find out what their stance is, find out what your hospital stance is, get the information you need so that you know ahead of time what that situation might look like. Because it really comes down to how sick is mom, how stable is baby, and what your hospital and doctors opinions are, and then what your personal opinion is. If you absolutely under no circumstance want to be separated from your baby, you have a say in that. And so, be educated, know what that means, and then you can kind of help make that decision from there along with your healthcare team. Now, as far as getting sick in pregnancy, we haven't seen at this point like a huge number of cases of COVID in pregnant mamas compared to the rest of the population. But that doesn't mean that you're not at a higher risk when you're pregnant. You do have a suppressed immune system when you're pregnant. That's just the natural part of pregnancy. So you do have a little bit higher risk of getting it. That being said, we just haven't seen that like a ton of pregnant moms have been getting it. But you do still need to be careful. Stay at home, stay away, self-isolate, wash your hands. Good hand hygiene is very important with this virus. So I wouldn't, I would be extra cautious as a pregnant mama, even though we haven't seen an increase in those cases. Because in the past, we have seen that with like H1N1 or SARS, we have seen pregnant mamas get very, very sick. And so we just want to be so careful when it comes to, lots of people, anybody, but especially our pregnant mamas, because there's 2 people involved with that. And it's just not a good situation when mom gets super sick and she's got a baby on board. So let's move into, I haven't seen any questions come through, so hopefully so far so good. When it comes to birth, a lot of moms are wondering, who can come in with me? Do I get to have a support person? What is my care going to look like in the hospital? What's going to be different about going to the hospital? And I want to start off by saying that if you've been planning on having a hospital birth, absolutely continue with that plan. The hospital is the safest place for you. Even with this virus, hospitals are being very, very cautious, especially in regards to the women's and children's units, and in any area. And they are absolutely there to care for you, give you the best care. I know some mamas mentioned that they're worried about them being understaffed. I have not heard that this is this case. And again, I can speak for the healthcare system that I'm involved with and the things that I know about my local area. I'm in Atlanta. But check with your healthcare facility if you're concerned about understaffing or not having enough support. But I would almost guarantee that you will have the support you need, and that you will absolutely get the care you need. Those doctors and nurses, whoever's at the hospital, they're there to take care of you. That's their job. That's what they want to do. So they're absolutely going to do their best to keep you and your baby safe and give you the care that you need. So I don't want you to be worried about not having the support you need just because you can't have all the people in your room with you like you maybe wanted. So that being said, most places are allowing one support person, and that support person needs to be healthy. When you get to the hospital, you, as well as whoever your support person is going to be screened. Anybody coming to the hospital is going to be screened. Doesn't matter what you're coming for right now. So they're going to ask you questions about any symptoms you've had, if you've had any known exposure to COVID-19, if you've been tested for COVID-19 and had a positive test. They're going to probably check your temperature, or at least ask if you've had any fevers, all those things. Now, if mom is, screens possible positive for COVID, they're not going to turn her away. She still gets to come in and have that baby there. Don't worry about that. But if your support person, say your husband or your partner, is possibly on that risk factor of having COVID, they may not let them in because they don't want to risk somebody coming in with a virus. So I would absolutely have a backup plan for a support person. Have a few backup support people. Let them know that they're your backup support people so that they can be prepared for that if it came down to it. Hopefully this isn't the case, because you absolutely want your partner with you when you're having that baby. I know this is such a hard time, and I know you're not going to get to have your doula, if you had a doula, or your birth photographer, or your mom, or your family out in the waiting room, because waiting rooms are closed. I know it's tough, but get a backup support person, and, make sure your family, especially like grandparents, know how to use things like FaceTime or Google Meets or Zoom or some kind of platform, so that you can still get that kind of that face-to-face time without being in person where everybody's at risk. So I know that's going to look a little bit different, but you're still going to have that support. Once you are in active labor and you're like pushing that baby out, you will have someone with you. A nurse is always assigned to you one-on-one once you're in that stage of labor, and they're not going to leave you. So I know one of the concerns we had was, will I have anybody with me? Like, they were concerned about how to know what they should do during labor in the hospital, because they were worried that they wouldn't even have anyone with them if they couldn't have a doula or whatnot. You will be taken care of, absolutely. Let's see. If someone has a cough from allergies, would they be allowed? That's a good question. I was just talking to a coworker of mine, and she's due any day now, if she hasn't already had her baby. I just saw her on Friday, so she may have had her baby. But she said a good friend of hers went to the hospital to have her baby. And now this is just speaking from my hospital. Okay. Don't take this as every hospital, but again, find out. They were screening her and her husband, and he mentioned something, I think kind of candidly, like just off, like jokingly about, yeah, allergies are so bad this time of year, and about how he'd had like a cough or sniffle. Well, they didn't let him in because there's no way for them to know if it's truly allergies or if it's COVID. And that's what a lot of people are so scared of, because allergies are horrible right now. My kids, up until like a week or two ago, were all coughing and congested, but I knew it was allergies because it happens to them every year, and they weren't fevering. They were totally fine. Like, I knew it was allergies, but nobody else knows that. And nobody else can say for 100% sure. So that being said, if they weren't actively coughing, make sure they're taking that allergy medicine. If your support person has bad allergies, like, take that allergy medicine. Do whatever you can to get those symptoms under control. But again, also just talk to the people that you'll be working with. Find out what their stance is on that, because I would hate for your support person to be left out just because of allergies. But everybody has to be so careful right now. And it's not just for like the hospital's safety or like the other patients. It's for your safety too. They're trying to keep those units so safe for you and baby. So just think of it in terms of like, they're trying to protect you as well. Okay, good question. Let's see. By the way, before I forget to mention it, I think Jessica dropped some links in the comments. I've got a free ebook on pregnancy, breastfeeding, and COVID. So a lot of everything we talk about and some more, you can download that free ebook. So you've just got it, and it gets continually updated as we know more. Okay, so it's constantly updated. And then the other one is for building a milk supply, which we're going to get into that more. But just so you know, there's an ebook for building a milk supply during COVID. And even if it didn't involve COVID, it's some great information for building a milk supply. So you might want to check that out. Let's see, a question. Any practical items if you do need to birth alone at the hospital, i.e. if partner is sick with the virus? Okay, so first of all, I don't know if you heard me say it or not, try to have, this is Kiki, try to have a backup support person if at all possible. I mean, you will be taken care of, absolutely, even if you don't have someone with you. Like, those nurses and doctors aren't going to just leave you alone to like labor alone. Okay. You should have, if you have an epidural and you can't get up on your own, like, you should have a call light. Make sure you have your call light. And they should be checking on you constantly. That being said, I don't know that there's much I would bring other than I always recommend bringing snacks with you, because you're going to get hungry, like once you've had that baby and you're nursing and whatnot. But whether you have your support person or not, they're not going to let that support person, or obviously you, leave and get food and come back. Once you're there in that room, you and your support person, or just you're kind of there for the duration, and then you go home when you're done, like when you're discharged. Also, if your mother baby unit had like a community fridge where they would let you bring cold items in and put them in the fridge, most likely they're not doing that anymore, just for the risk of contaminating each other's food. So bring things that don't require refrigeration. Bring the dry snacks, the packaged snacks, anything you can keep in your room. So if you are going to be alone and you don't have someone to make sure you've got your snacks and all that, then just make sure you bring enough of that. But I recommend that even with your support person, because they're probably not going to let that support person leave your room. Otherwise, I don't know that there's really much you need to bring other than what you would normally bring. I mean, your birthing situation is going to look very much the same, other than less people in the room when it comes to your personal entourage that you would normally have. Okay. I don't want you guys to feel like you're not going to be supported or cared for, because you absolutely will be supported and cared for just the same. Your team members, like your birthing team members, your nurses, your doctors, your techs, they might be wearing, most likely they will be wearing masks and possibly other things, because they're not only protecting themselves, but they're protecting you. Okay. So don't be scared by any of that. Like, it is such a normal scene right now to go anywhere and see people in masks. That's just what we're doing. That's what we've been told to do. And especially in the hospital setting, like my hospital, for example, everybody everywhere wears a mask 24/7. That's what we're doing. It protects ourselves and it protects everybody else that we care for. So don't be scared when you see your team, in head to toe gown, mask, gloves, whatever. That's just what is going on right now to keep everybody as safe as possible. Recommendation is to head to hospital as late as possible, especially if you need to birth alone. So when should you head to this hospital? Okay, that's a good question. So especially if it's your first baby, you might not know what it feels like to go into labor. That's a tough one. So I'm going to teach you about the 5-1-1 rule. So if you have been having contractions every 5 minutes and they are about 1 minute apart and they're lasting for 1 minute, they're lasting for 1 minute and it goes on for an hour, then it's time to probably go and get checked. So again, I think I said that wrong the first time. Every 5 minute contractions lasting for 1 minute each, the contractions, and then that goes on for 1 hour. And how you time between contractions is you start timing from the beginning of one contraction. So if you've seen it's kind of like a wave, the contractions. So if you start timing from the beginning of one contraction until the beginning of another contraction. So it's not from the end of one to the start of another. It's from the beginning of one to the beginning of another. Does that make sense? So that's a really good indicator for you. As far as true versus false labor, sometimes it's tough. If you're having contractions, if you're sitting, get up and move around. If you're walking, sit down, see what happens. If it stops, probably false labor. If you start walking around and it gets worse, or you sit down and it continues, it might be true labor. Of course, if your water breaks, if you start having any type of vaginal bleeding, you need to go to the hospital. But sometimes when you lose your mucus plug, like right before labor starts, you might have a little bit of pink discharge. That's okay. But if you're having blood, like a period blood, never okay. Absolutely immediately go to the hospital. So if you feel like you have to breathe through your contractions, you can't really talk through them, they're getting more intense, they're coming more often, you're meeting the 5-1-1 rule, go get checked out. Now, that being said, some moms go through that early labor phase for days. Like they're in labor, but they're not progressing quickly enough that they're going to be admitted. Some mamas will say, I was getting contractions every 5 minutes, lasting for a minute, for a whole hour or more. And then they get to the hospital and it stops. Or they get to the hospital and they're only a 2 or whatever it might be. And they're monitored for so long and they just don't progress. And you might be sent home. But listen, just trust your gut too. I know people want to avoid the hospital as much as possible right now. Like they don't want to be overexposed. But if you have any doubt or you're worried or whatever it is, go to the hospital and get checked out because it's better to be safe than sorry. It's not just you, it's your baby, and you just want to do everything you can to keep you and that baby safe. And I'm teaching virtual prenatal classes, and I talk so much more about labor and early labor and the 3 stages of labor and signs and symptoms of labor, and then how to manage labor at home and at the hospital. And the birthing process, and then going home with baby and breastfeeding, like all of that, plus some COVID elements. So if you're interested in taking a prenatal class with me, I would love to have you. I actually have one coming up next Saturday. I believe it's the 25th, I want to say, at 10 a.m. Eastern Standard Time. So I would love, love, love to have you join me if you want more information like that. Because I know too, right now, moms aren't getting that prenatal education because everything's canceled. Like there's nothing in person. So I'm so glad that I'm able to offer those classes virtually for mamas who might need it. And you can find that you can register through the link in my bio on my Instagram, or just message me, email me, and I'm happy to get you set up with that. Let's see, I'm getting questions and I love it. Let's see, what are the precautions we taken at doctor's office while using washroom and talking to doctor while they measure baby? Okay, so no, Kiki, I love your questions. Sorry for one more question. Are there any? Yes, we're going to get to the NICU. Good question. And then I'm going to answer this first question about precautions to be taken at the doctor's office. So again, I'm sure your doctor's office is being very, very careful about how they're handling things. Absolutely. And you know what? Don't be afraid to call your doctor up and say, hey, what precautions are you guys taking? What should I be concerned about? What are you doing to make sure we're staying as safe as possible? And don't do it in like a, drill them kind of way, like they're not doing their job, but just to like know, like say, hey, I'm concerned. I just would really like to know how you guys are handling things so that I can best be prepared when I come for my appointments, right? Also, if you have a healthy pregnancy, it's probably fine to talk to your provider, but it's probably fine to lengthen some of the visits out. Like if you're going every 4 weeks, maybe you can push it to every 6 weeks so that you're lessening the amount of times that you're going to the doctor. You know, of course, if you're a high risk pregnancy or you're towards the end and you're going more often, you might not be able to do that. But earlier on in pregnancy, normally, if it's a healthy pregnancy, you're not high risk, there's no complications, you can lengthen that out and it's not a huge deal. So talk to your provider about that. Wear your mask. Okay, so the CDC is recommending now, or strongly encouraging at least, that you wear a mask anytime you go into a more crowded public area. So wear your mask. I'm sure they will be wearing masks as well. Good hand hygiene. I can't stress that enough. Wash your hands immediately after leaving, you know, and when you're there at the office, avoid touching your eyes, your nose, your mouth. Try not to touch a lot of your stuff while you're there, because if you're touching things there and then you're touching your stuff, unless you go and clean everything that you touched while you were there, you could potentially carry that germ home with you. And yeah, when using the bathroom, I mean, it's just all about the good hand hygiene, because, you know, the biggest way this is spread is through the respiratory droplets. Okay, that's the biggest risk. So if somebody either actively has the virus or they're asymptomatic and has the virus, they're a carrier essentially, and they were to cough, sneeze, talk, laugh, breathe heavy, whatever it is, within close enough proximity to you, that's why we say keep 6 feet apart, right? That's like the strongest, like the most likely way you're going to get it is those respiratory droplets. That being said, those droplets, everybody's been hearing it, can stay on various surfaces for different amounts of times. Now, I haven't kept up with all the amount of times it can stay on this surface, that surface, because I don't feel like that's as important as just knowing you need to wash your hands. I can't stress that enough. And most people, I think the general population are pretty good at that. And I think if they weren't good at it, they're good at it now. But wash your hands. And you yourself should be practicing that good cough etiquette, like coughing into your arm, wear your mask, and then, you know, and we'll get to that. But if you're breastfeeding a baby and you've coughed or sneezed into your clothes, like change your shirt, just like do everything you can to keep yourself clean. Okay. Okay. So for the NICU, again, this is for my hospital system. It might be similar where you're at, but I would, you know, get in contact with your hospital. I wish I knew the answer for every hospital everywhere. And I don't even know where all of you guys are located, but our NICU, if a baby has to go to the NICU and mom is healthy, you know, has had a negative test and is asymptomatic, then mom can visit baby in the NICU, but only, as far as I know, it's only mom or dad, like one of them. They can't have both going in and out. So while mom's in the hospital, she can visit baby, but once she is discharged home, she can't come back into the NICU, just because like she was negative and asymptomatic while in the hospital, but now she's gone back home. She's been back in the community. She's been by whoever's been at her house. There's no way of knowing if she has picked it up or will pick it up. And if she comes back into that NICU, she's not only putting her baby at risk, but every other baby in that department and all the nurses or providers in that department who are caring for the babies. And so I know that is so hard. I cannot even imagine. I have been so blessed. I've never had a baby in the NICU. One of mine had to go to like an intermediate nursery for like a couple hours is all. And that was hard. I can't imagine having a baby in the NICU and then not being able to visit that baby. I know a lot of departments are setting up like a telehealth thing so you can still see the baby. But that's what my hospital system is doing, that once mom is discharged home, even if she was healthy while she was in the hospital and she still may be healthy, she can't come back to the NICU until that baby's being discharged. I know that is I just hope that doesn't happen to anyone, because that just breaks my heart for any mama baby that have to go through that. But your baby will be so well taken care of. So just know that, okay? What's the difference between airborne and droplet from breathing? So, I mean, droplets, that's a good question. It's kind of hard to explain. So for example, at the hospital, when something is airborne, we apply certain precautions, meaning we put them in a negative pressure room, meaning that the air from that room does not come out into like the hallways or other rooms, like it's sucked up into a vent, like taken away. When it's airborne, we use the N95 mask, like the respirator, so that we aren't potentially breathing that air in. That means it can be carried in the air, okay? So like tuberculosis, for example, is an airborne illness. And so if somebody were to come in with positive TB signs, we put them in a negative pressure room, okay? So like every emergency room, if I'm in the emergency room, I don't know if I said that or not, has negative pressure rooms, okay? And I'm sure other units have them as well if they're caring for, I know they do, if they're caring for a patient who needs to be in that negative pressure. Droplet, we wear, it can be a normal mask, eye goggles or an eye shield, like a face shield, gown, and gloves. Okay, so how we've been treating COVID is we're wearing all of it because it can be spread in droplets and it can be spread airborne. Does that make sense? So droplets are like, and they're like microscopic, but if you cough, you're putting it into the air, but you're also dispelling droplets, which also contain the virus. I mean, I'm not like a microbiologist. I don't feel like I'm like super qualified to completely explain that, but it's spread in so many ways. And so I do know that we are treating it as comprehensively as we can when we're caring for patients, and we are wearing all the supplies. And I'm going to kind of not switch gears, but speaking to that, we were talking about your support at the hospital, and you might have one support person with you as long as they're healthy, but you still are going to have that support from your medical care team. But if on your plan you were thinking about using laughing gas, which laughing gas is great, it can be an awesome tool for moms who are transitioning from like 7, 8, 9 to 10 centimeters through that last little part. It really helps them relax and breathe and not push too soon, because if you're pushing too soon against that cervix when it's not fully dilated, you're going to cause swelling and problems, and it's just going to make birth so much harder. But that being said, I think laughing gas may not be an option, at least at a lot of places. So again, check with your provider. But the reason why laughing gas is kind of being pulled right now is that it's like a mask that you breathe, right? And I think a lot of people think of laughing gas in relation to like dental procedures, but it's great for labor. But you're breathing it, and the way it's delivered, it aerosolizes your breaths and the droplets in your breath. And so because it's aerosolizing that, it's putting it into the air, and it's more forceful than just you breathing. And so it increases the risk of anybody in the room potentially getting COVID, whether you are positive, whether you are a known positive case, or whether you are a suspected COVID case, or whether nobody suspects that you have it, but you're just a carrier and you're asymptomatic. So because it's such a risk of increased contamination to everyone in that room, most people are not allowing the use of laughing gas. But that being said, talk to your provider and see what they say. They may have guidelines in place that if you check all these boxes, you're okay to use it. And if not, then you're not. But I think it's probably been easier for most hospitals and providers to just say, we're just not going to use it. It's too much of a risk right now. So that kind of just went along with the whole airborne droplet thing. So it made me think of that. I think I've answered all the questions that have come in so far. Keep them up. I love it. So I'm going to kind of keep going back on, my talking points that I had for you based on some of the questions we got beforehand. So we talked about, having some backup support people, and maybe have a backup plan for your pain control. If you were planning on using laughing gas, you do have other options. You have the epidural, you have the narcotics. And again, I talk about all of that in so much detail in my prenatal class. So I'd love to have you join us for that. There's also like the water, the heat options, positioning options, pressure. So yeah, there's so much that you can learn about pain control. We talked about briefly at the beginning about moms and babies staying together or not staying together. if mom happens to be positive or is symptomatic. So the CDC, like I said, is cautiously recommending that moms and babies be separated. There's two options for that. The first option would be that they have separate rooms. The other option would be that baby could stay in the same room as mom, but they would keep them 6 feet apart at least. And whoever the healthy support person is with mom, so maybe it's dad or whoever, grandma, they would be the one to care for the baby in the hospital. Okay. And then they do, I mean, it's so hard because then people are like, okay, well, mom and baby are just going to go home together after this, right? Yes, they are. But it is recommended. And it's so, I just struggle even saying this because it just is so hard for so many reasons, but that mom keep her distance from baby, until she's symptom free, which would be 72 hours without a fever and at least 7 days since the onset of symptoms. Now, I know this raises so many red flags for mamas like, okay, well, I planned on breastfeeding. What do I do if I can't immediately start breastfeeding my baby? That's where we get into the whole having a really good pumping plan and milk supply plan in place before you even have baby in case this happens, because baby will breastfeed even if breastfeeding is delayed as long as you have a good milk supply. Okay. So all is not lost if you plan on breastfeeding and you happen to need to be separated from your baby for a little bit at birth. I hope, I pray that does not happen for you, because that is so hard and no mama ever wants to go through that for any reason. But some mamas deal with that not during a pandemic because their baby has to go to the NICU or whatever it might be. So, and again, you will have a say in this situation and whatnot, but the CDC is recommending you still give your baby breast milk. Absolutely. Breast milk is a great thing. Based on the data we have so far, COVID-19 is not being passed through breast milk. And in fact, we believe, based on what we've seen so far, that the antibodies of COVID-19 are being transmitted through breast milk, which means it's supporting your baby's immunity against COVID-19. So that's a good thing. So right now, absolutely give that baby breast milk, whether they're a newborn or whether your baby is 3 months old and you happen to get sick and you've been nursing. Like, don't stop giving them that breast milk. But you probably want to consider pumping and giving it to a healthy caretaker to give to your baby. Okay. If you're going to breastfeed and you're sick, and this really applies to any illness, like if you're sick with anything and you're breastfeeding your baby, you need to be careful because you have close contact. But hand hygiene. Breasts, keep your breasts clean. Okay. Wash them before and after you breastfeed. If you're pumping, keep those pumping parts so clean, keep them sterilized and clean. Store your milk properly. Okay. It can stay at room temperature for up to 4 hours. And then if you say you're probably not away at work because nobody's away at work, but if you are, like in my case, I'm a nurse and you were pumping, it can stay in a cooler on ice packs for up to 24 hours. Freezer 6 months, and it doesn't have to be like a big, huge, deep freezer, just your normal refrigerator freezer up for up to 6 months. If you put it straight into the refrigerator, up to like 72 hours. And those timelines, those are like the minimum. They can be pushed a little, like milk could potentially be good up to 8 days in the refrigerator, if you put it in fresh. But you would want to ensure that you collected it under very, very clean sanitary conditions, okay? So if you're going to breastfeed though, and you're not going to pump, then wear a mask, clean your breasts, clean your hands. If you've been coughing into your arms, your sleeves, change your clothes. Make sure you are so clean before you touch that baby and feed that baby. Okay. Because you need to do everything you can to keep that baby healthy. And there's so many ways that COVID-19 can be spread. And the respiratory droplets are like the biggest way that it's spread. It's, especially, so wearing that mask is going to help. If you are just coughing like crazy, if you are so sick, if you are fevering, I would just say, take care of yourself and rest and let somebody else feed that baby if that works out, and just pump for that baby, okay? And it's okay if you have to give your baby formula. I just want to say that, of course, I encourage breastfeeding. Breastfeeding is great, but that does not mean you are a bad mom if you have to give that baby formula whatsoever, okay? I just want you guys to know that, okay? But where building this milk supply is so helpful is that when you give birth, you're already going to have a milk supply essentially established. Like, your milk's coming quicker. And this is done through what's called antenatal hand expression. And in one of the ebooks I mentioned that you can download for free, it's going to talk about this. It's going to talk about all the ways you can build that milk supply, whether you are currently pregnant or about to have your baby. But with antenatal hand expression, you start around 37 weeks of pregnancy after you have consulted with your healthcare provider, okay? Because if you are at a high risk for preterm labor, or you have something like placenta previa, those are reasons where you would not want to do antenatal hand expression. But if your provider gives you the clear, the okay, then it's a great, great thing for you to start doing at 37 weeks. And you're going to hand express on each breast 5 minutes each side, twice a day. So like morning and night. Now, how this works, hold on. Gotta grab my boob. So, think of remember, babies don't nipple feed, right? They breastfeed. So same thing when you're hand expressing. You're not just gonna like squeeze your nipple, okay? That's not how you hand express. You've got ducts and glands all through your breast, okay? So not only you need to go further back, okay? And not only, you don't want to also just work on one area. You've got to work all the way around your breast so that you're stimulating all of them when you do this, okay? And you're not going to just squeeze. That's also not the way you do it. So you're going to kind of push back, kind of squeeze back and together, okay? Squeeze back and together. And that's how you're going to do antenatal hand expression. And you do, again, it's 5 minutes each side, twice a day. Now, the first time you do this, the first few times you do this, you might not get anything. You might get like a little glistening, but you might not get much, and that's okay because you're just starting the stimulation process. But as you do start getting those drops of colostrum, that liquid gold, as we like to say, which is really thick, remember, and when baby's born, just remember, their stomach is so tiny. They don't need a lot right at first, and colostrum is so dense and nutrient rich, they don't need a lot of colostrum compared to like breast milk. So once you start getting drops, you can collect it with a little medicine cup. Now, this is just one that I got off of some medicine I bought for my kids, right? I have a whole basket full of this with all my medicine. So, but make sure it's super sterile and clean before you use it, okay? So you'll start collecting. And if you need help while you're, over here expressing, your partner can help you collect the drops, but collect the drops. Once you're done with your session, you can collect both sides in the same one. You're going to get a little medicine syringe. Now, this one is a 5 ml syringe. I would recommend getting like the 1 ml syringes, which you can get from your pharmacy. They might even know them as colostrum collection syringes. You're going to draw up whatever you collected, right? You're going to put a little piece of tape on it, like get the, what's it called? Like the masking tape that you can write on, write the date and how much. And then and the ones that I'm talking about, the syringes have a little cap, which is great because you're going to want like a little cap on it. So put the cap on, then have like a Ziploc bag, stick it in the Ziploc bag and stick it in the freezer. If you do this for like the last 3 weeks before you have your baby, you could have so much colostrum built up. And this is beneficial for a lot of reasons. One, if you are COVID positive and you can't breastfeed your baby right away, you've already got a stash of milk. Here you go. Feed your baby with that, whoever it is, like whether the nursing staff has to feed your baby or your healthy support person, you have got your own milk ready to feed that baby, okay? And then you can continue pumping and bringing in that milk supply until you can breastfeed, which when you're going to do that, you need to be pumping and hand expressing, alternate every 2 to 3 hours, 24 hours a day, okay? So you want to be pump and then 2 hours later, hand express, pump, hand express. 2 to 3 hours a day, 24 hours a day to get that milk supply established. Because remember I said, even if breastfeeding is delayed, baby will still breastfeed if the milk supply is there. Okay. So antenatal hand expression is a great tool to it just increases your chances of successful breastfeeding. And especially with the risk of delayed breastfeeding, it's just going to help so much. Also though, if you have a baby who is born with low blood sugar, which I know a lot of Jessica's followers have gestational diabetes because she's an educator for that and she's awesome when it comes to that. Your baby, a lot of times when you have gestational diabetes, has low blood sugar. Well, if you've got this colostrum stored up and ready, they can feed your baby this colostrum. They don't have to get a formula bottle. Not that there's anything wrong with formula. I already said there wasn't. But if you can give them this colostrum, how awesome is that? And if you have COVID, or even if you don't, you're giving your baby antibodies. You're building their immune system, which is so important. I mean, especially during this pandemic, but all the time, your baby needs that support from breast milk. Even if you don't plan on breastfeeding for a long time or at all, you could still do this and get that colostrum and get them all that colostrum in their first few days of life, which would be so beneficial for them. I have a workshop coming up, not next. So it's not this coming Monday, but the next. I can't think of the date, like the 27th maybe. I have a prenatal feeding workshop. I'm going to give you all the tools you need to create a feeding and pumping plan for your baby before your baby's even born. Teach you more about antenatal hand expression, help you know what supplies you need, help you create a plan. So it's a group workshop, but then I schedule 15-minute assessments with just you to talk to you, find out more about you and your situation, and help you get a plan in place so that you are so prepared to feed your baby, even if it's bottle feeding. Like we're going to talk about bottles, soothers, breastfeeding, what to do if you have sore nipples, what to do if baby won't breastfeed, how to latch, all of that stuff. Hey!
I finally figured it out.
I'm so glad to see you. Well,
yes, I mean, thank you so much. I'm going to let you keep talking, and I'm going to share your details for your workshop on the page after as well.
Awesome. Yeah. Okay. Awesome. All right. So now we've got Jessica, even better. You don't have to just keep looking at me. But yes, like I said, just be so prepared for that breastfeeding journey or whatever it might be. And so this feeding workshop would be great.
Awesome. Well, thank you so much for this. Can you remind people again where they can find you, where they should follow you? And I'm going to put the links to those ebooks as well.
Yes, absolutely. So I'm on Instagram, Lyndsey.themamacoach, Facebook page as well, the Mama Coach Lyndsey. You can find all my services through the link in my bio on Instagram, or you can go to the Mama Coach website and you can find me and you can find all the services, lots of great articles and blog posts about anything mother-baby related, and then some, more than you could ever read. So it's just a great resource for you. But reach out to me. I offer free 15-minute phone consults for any service you might be needing. And I'm just here to support you and I'm happy to help you. So please feel free to reach out if you have any questions or any needs. And yeah, like I said, I've got an upcoming prenatal class, an upcoming prenatal feeding workshop, and then also an upcoming sleep webinar. If you've got a toddler, you want to get under control with sleep before baby comes or something like that, I'm happy to help you. I think that's it. Thanks so much for joining.